Testing, yes. Good morning, everyone. Sawadee ka. I'm Dr. Mei Lam from Hong Kong, and happy to see you today and this early morning. And then today, my topic is less is more, achieving more elegant and natural results combining collagen stimulator and HA filler. So, why we need less? Because nowadays we have overwhelmed by the overfill syndrome, and then a lot of clients are afraid of too many fillers, and then they're afraid of too puffy face. So now we are more towards a natural approach to aesthetic medicine. So less is more. We can combine collagen stimulator using polyathletic acid and HA fillers and including skin boosters to achieve a more natural and elegant result. Why we combine collagen stimulators and HA fillers? For collagen stimulator, we can achieve a long-term result with structural support. And HA filler, we can provide an immediate result, and then we can have a precise enhancement. For skin boosters, obviously we can improve the skin hydration and radiance. So what we have to avoid? We have to avoid overfilling while achieving a comprehensive rejuvenation, and we can use minimal product for maximum result. And then we can focus on natural, balanced, and long-lasting result. So step number one, which is not necessarily the first step, but this is step number one. We can use collagen stimulation by polyathletic acid. So the polyathletic acid I'm using in my clinic is Sculptra, which is FDA approved collagen stimulating polyathletic acid. And then the shape of the crystal you can see under the microscope is like a plate, rather than a sphere or with a round shape with a lot of pores. So it's a smooth surface plate-shaped crystal that is very characteristic and is standing out from other brand of polyathletic acid or PDLLA. So it's only PLLA. So it only have the L side of the crystal. So what is it used for? It's a collagen stimulation, and it has long-lasting result. It can last for 25 months, and it's ideal for larger area of improvement, such as temple, lateral cheek, and medial cheek. So the other step, we can use HA fillers to lift, to refinement, and to do skin hydration. So the HA filler I'm using in my clinic also has two different types. One using the natural technology, the other using OPT. So natural technology is actually is a very old technology, but it's still very effective and powerful. It stands for non-animal stabilized HA, which has natural cross-linking together with the synthetic cross-linking. So the synthetic cross-linking actually has less than 1%, which is very different from other brand or other series of the HA filler. And this product has very high G prime, which stands for it can do a best job for the structural correction and lifting. How about OPT? OPT, what does it stand for? It's Optimized Balance Technology. So it's combining different degree of synthetic cross-linking with the particle size to achieve different level of gel flexibility. So it is a softer, a flexible gel, which is suitable for dynamic areas such as lips or perioral area, esolabial fold, marionette line, where we have a lot of animation. We have to move, we have to eat, and we have to do a lot of facial expression, and that can achieve a very natural result. So on the left side is the natural filler. You can see the filler can pile up like lifting like an anchor. For the right side is OPT filler. You can appreciate the very different characteristic between these two fillers. One is very stiff because the G prime is very high. The other is very stretchy. You can really stretch the filler and it will not break, and it can be more flexible. And then one can imagine the right side can be used in the dynamic area, and the left side can be used like lifting and contouring. So how about Skin Booster? Skin Booster is a small particle nanoshell technology filler that used mainly for fine lines and skin growth and then the radiance of the skin. So we are approaching our clients using a step-by-step approach. I will explain it using a case example. So this is case one, 75 years old lady using a hybrid protocol for long-lasting result because she wants an immediate result. However, she also wants a long-lasting result. So I combine both filler and polyallylic acid. And her main concern will be the sagging cheek, the nasolabial fold, the hollow temple, and the overall tired appearance. So this is the before. And you can appreciate the volume loss over the mid-cheek area, the temple, the lateral cheek, and then the lower face sagginess. Step one, I will use HA filler. So I will use the nanoshell technology on the zygomatic arch for lifting, and then OPT filler in the medial cheek for volumization. So this is step one. Step one, to achieve immediate result, to improve the sagginess and then overall tiredness. So this is using nanoshell technology, needle injection, 27 gauge needle deep to the bone, bolus injection for lifting, and then 27 gauge needle piriform fossa, bolus injection for the improvement of the nasolabial fold. And I switch to OPT filler for medial cheek improvement. So medial cheek using a 25 gauge cannula fanning technique on the medial cheek subcutaneous layer. So step two, after the filler, I use a collagen stimulator to achieve a longer lasting result. She received total 4 sessions of polyallylic acid, and each is 6 weeks apart. Total 7 vials of syringes is given. So this is before and after. You can appreciate the 3 months afterward. This is the 3 months after. And this is up to 16 months after. And one can appreciate the immediate result actually can last and then can continuously improve even after 1 year because of the long-lasting result of the polyallylic acid. And not just the volumization and the lifting, but also the general skin quality. And when we close up, there is improvement of the jawline and the nasolabial fold, and then also the skin quality, the fine lines, and the wrinkling has been improved, and the general skin texture and radiance of the skin. So second case, how about for those who need a structural support and other details to refine? What do I mean? For example, for this 82 years old lady, she has generalized sagginess and loss of volume on the overall area, and also she has very thin lips because of aging. And then combine the polyallylic acid with filler for both structural support and for detailed refinement. So for her case, she has a gradual sagging, the middle face and lower face, and also the volume loss over the bilateral temporal area, medial cheek, and then the lateral cheek, and also quite a lot of fine lines, and then perioral fine lines and wrinkles. And the first step for her will be polyallylic acid. This is her treatment protocol. She received total 3 sessions of polyallylic acid, aged 6 weeks apart, so total 6 vials given. For polyallyl acid, I prefer to use cannula because it's more evenly distributed in correct plane, and then the patient's the comfortability is higher, and also the downtime is lower because of less injection point. So this is the temporal area injection using the fanning technique, and this is the lateral cheek area using the 25 gauge 40 mm cannula. And the reconstitution of this polyallyl acid is 8 ml plus 1 ml lidocaine. So step 2, after the sculpture, after the polyallyl acid, I've focused on her detail. So the detail will be lip augmentation. So I'm using the OBT technology filler for her case because it's very natural and stretchable, and it's very suitable for very fine thin lips as her case. So I am using the 25 gauge cannula for the upper and lower lip volumization. And then using the sharp needle to create the vermilion border. One can use the same OPT filler or using a larger technology filler to achieve the vermilion border. So finally, I touch on the tubercle. So after polyallyl acid and lip filler, one can appreciate the effect is actually very gradual, and then up to 18 months you can still appreciate there is a gradual improvement on the overall laxity, sagging, and then skin texture. And this is the three-quarter view. On 3D vector photo system, one can appreciate the sagginess on the nasolabial fold, the jawline, the jaw, and also the general skin tone has been improved. For her lips, she starts with a very thin, dry lips with a lot of perioral wrinkle. So after the filler, the lips still looks thin, but it has been more hydrated, and volume has been improved, and the proportion to the face has been improved. So when she do dynamic movement, one can appreciate the natural appearance of the filler without any doublet or other unnatural lumpiness or unevenness of the filler. So case 3. Case 3 is a younger lady, 42 years old. So the concept for this case will be a prejuvenation because she is still young and she has not much problem to start with. She has early volume loss in the cheek and temple and mild under eye shadows and some skin hydration. So the main aim is the prejuvenation rather than rejuvenation. So we prevent the aging to occur with collagen stimulation. And also, because of the dry skin, we achieve HA booster for the skin radiance and hydration. So this is her before photo. She has early volume loss on the bilateral temple area, medial cheek, a little bit of the lateral cheek, not much jowling and sagging on the lower face. So step 1 will be the polyallyl acid. Using this treatment protocol. So she received total 3 sessions of polyallyl acid, also 6 weeks apart. And this is her before and after. One can appreciate the volume on the face is very natural and gradually improved. Overall skin tone and then overall contour, the smoothness on the contour has been improved. So second step actually is a skin booster because she has fine lines and wrinkles, and then the skin radiance is not as good, so I adopt the skin booster. So after skin booster, the fine lines on the perioral area has been improved, and then the pore size and the skin texture on the mid face has been improved, and then the fine lines and the dryness on the forehead has also been improved, and she has not received any neuromodulator. And the final case is a 59 years old gentleman. So gentleman is quite not a large portion in our practice, but for him, he need lifting and contour, and also we have to adopt the filler for some highlight because he has shorter chin in proportion, and then his lips is also thin and dry, and the mouth corner is downward turning. And then the goal for him will be a natural lift and a balanced appearance. So this is his before photo. So step one will be polyallylic acid again. So this is his treatment plan. Total 3 sessions of polyallylic acid given, each 6 weeks apart. Total 6 vials given. So for his case, it's not only the volume loss area. I also put some polyallylic acid at the jawline and then the pre-chin sulcus. Step 2 will be the chin, the jawline, and the lip augmentation. So this is his treatment plan. I'm using both Nasha technology and OBT technology for his case. So Nasha technology for the chin and the jawline because it has a higher G prime, it's more firm, and it has a better shape. For lip, it is best to use OBT because it's very natural, and especially for gentlemen, they do not want done lip. They only want more youthful, hydrated lips that nobody notice. So for him, definitely I'll choose OBT filler. So this is his lips before filler. Not just the shape and the thinness of the lip, but also the corner of the mouth is connecting to the marionette line. It makes him look like he's very sad and age look. So these lips we can improve by the HA filler. So for chin and anterior jawline, I'm adopting the cannula approach plus sharp needle approach. So for cannula, I'm using 25 gauge 40 mm cannula and Nasha technology filler. And for mid chin, I'm using a needle to create a bolus injection. So this is his before and after. So after polyallylic acid plus HA filler for chin and lips, one can appreciate the general youthfulness of the contour and the skin texture and the jawline definition and the chin definition, and also the lips shape and the corner of the mouth all improved. So he looks younger and lit up in general, and he doesn't being feminine, being too done. So this is his lip after. So you can appreciate the before and after. He still look very natural. And this is animation before, and this is his animation after. So one can appreciate the natural appearance even during animation after the HA filler. So take home message today will be less is more. So we have to specifically plan the area we want to treat. So is it addressing the structural area? We can use polyallylic acid. If it is more refined area or definite area, we can use HA filler. For skin radiance, we use the skin boosters. So we have to avoid overfill because we are using polyallylic acid. That's why we can use less HA filler to do the normalization and lift up. And in general, it can create a more natural balanced outcome. And because we are also combined with polylactic acid, it can make our result even longer. It can create a longevity result with elegance. So we can also create a holistic approach because we are combining different modalities with collagen stimulator and different type of exchange filler. So we can do a holistic approach for individual patients. And hence, we can achieve a higher patient satisfaction. So the key word is less is more. For this case, she aged gracefully because she's already in her 80s, and then combining both polyalactic acid and HA filler and skin booster, she still looks very natural and elegant and even younger 1 year later, age 83. So thank you very much. This is my presentation.
Thank you, Dr. Mila, for your presentation. If you have a question, please raise your hand. Okay, if there are none.
From the audience. Can I have a comment? Yeah. I really am amazed and in awe of the presentation of Dr. Mila as always. Okay, she presented excellent results as well. And the thing is, so I love the topic. It's less is more, and natural is the key. Simple is best. And her patients, I noticed 70s, 80s. It's not really easy to, rejuvenate those kinds of ages, right? But right now the trend in aesthetics is if you're 70, 80, we want to make you beautiful in that age. It's not your 80, 70 making you 25, 30. So that's the trend nowadays. So less is more, simple is still best, and natural is the key, right? So I just have a question because it's still a combination treatment, right? And of course, for our students here, I am pretty sure you want to know where to start first, which to prioritize, because I noticed you were mostly starting with the biostimulator and then your HA. So how do you decide on that for each patient? Like you had a 40, 70, 80. Yeah, how did you know? How did you decide? Something like that for the benefit of our students as well.
Yes, thank you for your question. And for actually for the first case, I start with HA first, and then polyalactic acid. So it is very complicated questions because we can do it very differently for different individual. It's not just because of their age, also because of their skin type, their skin laxity, and then how much water loss, and then how much sagginess, and then is there any severe proportional problem. And most importantly, we have to communicate with our clients or patients. What do they want? What do they need? Do they need a natural result, and then do they have time? If they have, they are not in a rush, and then we usually I would adopt the polyalactic acid approach first. If they're in a rush, they have to be in a wedding or in a photo shooting next month, and then I have to do the HA first, but I have to remind them to come back for the collagen stimulator for longer lasting result. So usually I will have to communicate, and then each individual is really different. So really has no such a formula, simple formula, but yes.
Yeah, I do agree. We're both KOLs in Galderma, right? This Galderma has this FAS, the facial assessment scale, where you assess your patients based on skin quality, the shape, the contour, the proportions, the sagginess, the volume loss. So there's this scale, then you grade on mild, moderate, severe. And then whenever I follow that guideline, it also helped me in which part of concerns will I prioritize. more of the, see that there's disconnecting the dots. If you remember that circle thing, the FAS, then you have the number 3, then there's number 2, number 1, and then you make your connecting the dots. Then you can show it to your patient as well. And somehow that also helped me and my patient to like prioritize as well. Like if the concern is like there's more of the skin quality problem, then we start with that. And the thing is, like I noticed there's a lot of vials of Sculptra, and actually in my practice, it's a very expensive treatment, and my patients can only afford 1 vial, something like that. So since our topic is less is more, if I'm gonna ask you like which would I start first, that will really give a big impact for like a first-time patient, so that we can have them come back, right? Patients come back when they see results, and patients come back when there's no pain. Okay, so like if I have like my patient only has this amount, this budget, what will be like if you can advise us also? My students are ACs, which will be because like they can afford the HA more than the Sculptra, because I think Sculptra is $1,000 per vial, and the HA is, it depends on which region. Like if I practice in the States, I can charge higher. Okay, so if you can give our students also like something that's gonna give a big impact.
Well, yes, I agree with the approach that for the first-time client, sometimes we have to give them what they need and what they want, and then it will be a great impact. But however, for a lot of my clients, new clients, they are referred by other friends that they have received the polyhyaluronic acid. And their first treatment, actually, they are requesting the polyhyaluronic acid because they see the good result of their friends. So it depends, it really depends of what your usual practice is. And for Hong Kong region, actually 1 vial of HA filler is similar to 1 vial of Sculptra. So in